The world-renowned Institute of Health Metrics and Evaluation at the University of Washington releasing new COVID projections just this morning here. Experts with the Institute concluding that their virtual press conference on how the emergency phase of the pandemic may actually be ending. Fox 13's John Hopperstad has been monitoring this. John, is this true? Actually ending? I mean, that's hard to believe after two plus years of this.
It was hard to hear this, Liz. Yeah, you're right. We've been dealing with this for 2 years now, but there is some good news. According to those UW researchers this morning, in just the last few moments, they say the emergency response we've lived with now for 2 years, all the restrictions may be lifted by this spring, with COVID becoming more endemic like the seasonal flu that we will simply have to manage. Now, the researchers say that's because of how quickly Omicron, which is much more transmissible, has swept through the population. But the severity of Omicron and the number of deaths have been much lower. For instance, among those people who have symptoms, those who end up in the hospital due to Omicron turn out to be half as much as what it was for Delta. And there has also been a 5 to 10-fold reduction of people dying from COVID while in the hospital. So doctors say the virus is running out of people to infect right now, and along with so many now being vaccinated with this wave, they believe we will get to functional herd immunity possibly by March or April.
We think that because this wave will move quickly through the population, we will go into this period where, the immunological exposure to COVID is so much higher, both from vaccination and infection, that we won't see restrictions return. So I think we will go back to normal in the sense that we won't have major restrictions on behavior, and that COVID becomes endemic. It's just a disease that we will have to manage.
Doctors say there are still countries like in South Asia that haven't seen a surge in the Omicron variant, but that by the end of March, more than 50% of the world will have been infected with the Omicron variant. Those researchers suggest that increasing mask use or expanding vaccination coverage in the next few weeks not going to have much of an impact on the Omicron wave. But the hope is that by the spring, the pandemic could be over, though COVID, as you heard, will still be with us like the seasonal cold and flu. That's the hope right now anyway, guys.
John, thank you.